Now, over 500 South African medical students are left in the lurch in Cuba. It's reported many of them have completed their 5th year and have since been stranded there with no stipend, no food, and left in dire straits since May. The South African Medical Association is now urging the Health Department to expedite their safe return. Let's bring in the association's Vice President, Dr. Mvuyisi Mzukwa. Thank you very much, Doc, for your time. Now, according to the reports that we've seen and according to your statement, for instance, these doctors have last been paid on the 31st rather of May. That's about 2 months ago. And also the department saying that it will fly them back between the 24th and the 25th of July. That's gone. Those dates have gone and have passed.
Good evening, Masiko, and good evening to your viewers as well. Thanks for having Sama in your program. We are really concerned, like you said in your introduction, about those students in Cuba who are stranded there, cannot come back to the country. You know, we understand that there are issues with COVID-19 and also that the issues that are put on the table by students to say that the department must pay the stipend, you know, from May, so that, you know, they are obviously to take into consideration the fact that these are young people who are stranded in a foreign country, and we cannot afford, as a parent sitting at home looking at media reports of students, your child out there suffering in those conditions that we have seen in some of the reports.
Mm-hmm. Are you privy, Doc, about any information on the promise that these students would be paid by the 28th of July? That deadline is today. Are you privy to any information that they have in fact been paid their stipends now?
No, we do not know whether it has happened as yet. We have requested an urgent meeting with the Department of Health to discuss this matter, because to us it's an urgent matter that must be attended to as soon as possible. So in that meeting we'll verify if that has happened, and also will be briefed regarding these flights that have gone to Cuba to try and bring those students back to this country.
I want to talk about these flights, and the dates that was promised by government was the 24th and 25th of July. And like I said earlier, those dates have come and gone. But also over and above that, we've read reports that some of these students, these student doctors, have been stuck in Cuba for 5 years. So, you know, this coming to light now, wouldn't you agree with those who say the South African government doesn't care about its doctors then?
Well, we hope that is not the message on the attitude of government, that they don't care about their own citizens. We are worried that students can be in a foreign country without any form of financial support, you know, because, I mean, you can imagine how do you live in a foreign country when you do not have that kind of support. So it is upon the Department of Health to prove those allegations, whether they are true or not. But our plea at the moment is that the government must take it very seriously, that our young people, our young students are stuck in a foreign country. They didn't go there, you know, on their own. They were assisted by government, and government must make sure that, you know, it was very easy for them to fly doctors from Cuba to South Africa. Why can't it be easy for them to fly those students back, you know, even during the time of the pandemic? And it was easy for them to, you know, give financial support to the doctors who came from Cuba. Why can't they do the same with our own students, our own children in this country? So this is our plea, that we don't need to have any further developments on this story. We just need our students coming back, and they must be safe, and they must be given their demands. Their stipends must be given to them.
That's very profound, Doc. And while I still have you, I just want to ask you about something else. I think a lot of people are asking themselves what's attributed to the last 24-hour numbers of our COVID-19 infections here in South Africa going up. We were recording between 11 and 12,000 for at least 2 or 3 days. And now it's at 17,000 with provinces such as Gauteng jumping from about 2,000 to 5,000. As a professional in the field of medicine, what would you attribute these numbers to? Could it be that people were not getting tested because of the unrest 3 weeks ago?
There are so many factors. One is that we had these riots and the unrest in the country, and we've been waiting, to see if that is going to have any effect. And we've been having many political gatherings, where there's no wearing of masks and all those things. But also, like you said, there was no access, even to testing sites and also the hospitals themselves. So if you have that kind of environment, you are bound to have cases where people will die or will become severe or severely ill because they don't have access to any healthcare facility. But on top of that, I do think that our tracing team on the ground should be doing the work much more than before. Because what is happening now, you get people who test positive, but they don't like their relatives to be tested, or even relatives refusing at times to be tested. So if you have an asymptomatic person going out there, the virus will be transmitted from one person to the next, and that will complicate this whole thing. And I think health education must continue on the ground.
And Doctor, you heard during the course of the week many of our government officials saying that we've surpassed the third wave. Maybe they jumped the gun.
I think, that's my challenge with, some of our colleagues who are called experts. At times, I think we do get excited over a very short period. I mean, really, look at, we have not even done our week average, and then we're already pronouncing on reaching a peak. I think we are quick to say things and making people, drop their guards, when it comes to prevention with the non-pharmaceutical interventions. This thing of making pronouncements to say the third wave is not going to be the same as the other waves, it landed us where we are today. So I think that is very dangerous to just jump the gun and make pronouncements prematurely.
Dr. Mvuyisi Mzukwa, thank you so much for your time, Vice President of the South African Medical Association.